Hi everyone and welcome to Doc's Thoughts. So I want to talk a little bit about acne. A lot of my patients struggle with acne, whether it's a young teenager or some of my older patients who are having hormonal issues. Acne can be a real problem. And it's not always on your face. It can be on your backside, it can be on your back, it can be in your armpit area, and it can be really, really bothersome because it can be painful. And for some people, it can almost be disfiguring where they feel really self-conscious about the lesions on their face specifically, or even their back. And these are some of the first things I talk about with my patients when we're trying to work on their acne. So first of all, we talk about their hormones. So if it is a hormonal problem, we look at where the hormonal problem lies and if we can reverse it in any way to help make the acne go away. There's obviously different medications, both topical and orally, that you can take that help with hormonal issues. There's also ways you can balance your hormones very naturally, so it doesn't always have to be a drug, but we definitely look at what's going on hormonally. The second thing I think about is their hygiene. So how often are they washing their face? And this can go both ways because you can actually overwash your face and actually trigger more acne. Other things I think about with hygiene is, in the area that you have the acne, how often are you washing the clothes that touch that area? Or if those clothes get sweaty, how fast are you taking them off? So super simple stuff that people just don't always think about. So we talk about skin hygiene. The next thing we talk about is the products they're using on their face, because even some of these products that are advertised as being for acne or natural or healthy can be very acne provoking. So it's really important that you use the right products that are meant for a skin that is prone to acne, both on your face and your entire body if you're suffering from acne. And then we talk about certain foods that might be triggering their acne. So I know some people have been told that food doesn't matter. I would like to debunk that myth. It absolutely matters, and it matters for some more than others. So we definitely do a good deep dive into what they're eating. And sometimes we even do food sensitivity testing to see if there's any foods that come back highly reactive on that test, because then we might remove those foods for a while and it may help reduce the acne in addition to everything else that we're doing. And then lastly, what's really important is talking about the integrity of their gut. Every patient I have who comes into me with a skin problem, I think about their gut. And every person who comes into me with a gut problem, I think about their skin. They are very, very closely entwined most of the time. And so it's really important to think about how healthy is your gut? Is there inflammation? What is the health of your microbiome, which is the bacteria in your gut? And if that seems to be off, that is usually where we start, in addition to all the other things I was talking about. So hope that helps. If you're someone who suffers with acne, know that it's a really multi-dimensional problem and there's not one quick fix for everything. You need to work with a provider who looks at all the different pieces and tries to give you the best plan possible to move forward. Hope that helped.